Massive demonstrations of protesters demanding an end to police use of fatal force are bringing with them the start of another concern, further spreading the coronavirus in the middle of a pandemic. There's also worry about the use of pepper spray specifically to disperse the crowds. Joining us is Dr. Peter Chin-Hong, an infectious disease specialist at U.C.S.F. Health, to let us know about why he is now one of more than 1,000 people who signed a petition against using that tactic. Hello, doctor.
Hi, thanks so much for having me on.
Thanks for being here. So can you tell me more about that petition that was started at the University of Washington and why you are one of many who are now warning police about the use of tear gas?
I think we're worried about it because this is a COVID pandemic, and there are several things about tear gas that make people who have COVID more infectious, as well as people who don't have COVID uh, are increased risk for getting COVID.
And so the tear gas itself doesn't make one vulnerable to contracting the virus, but it's the behaviors that come with it, like coughing and touching your face, that my understanding is increases the risk.
Yes, totally. So in someone who has COVID, if they get tear gas or other irritants, what happens is that they cough more, they might be screaming. Both screaming as well as coughing projects the virus further distances because the virus travels on droplets, which get more efficiently transmitted if you're coughing or you're screaming.
We've also seen video of well more than 10 people packed closely together across the country marching in unity. What is the risk of spreading the disease?
So it comes back to basic biology of how COVID is transmitted. What the virus is trying to do is get from your nose or mouth to somebody else's nose or mouth. And being packed together, particularly not wearing masks, is probably the most efficient way of being transmitted.
And so could we see a second wave sooner than what was projected in the fall now that we are seeing these mass gatherings?
I think a lot of us are worried, but we're also balancing the need that people have for raising their voices in protest, in anger at some of the things that are going on in our country. So I guess one of the motivations, coming back to the original question about why we decided as infectious disease doctors and other healthcare professionals to write this, is that we wanted to meet people where they were. Didn't want to say, don't do this or don't do that, but realized that people wanted to take risks to voice their opinions, and we wanted people to be safer around that.
And so it's only in the next few weeks that we can determine whether this really made an impact on the spread of the coronavirus. But is there any possibility that it would mean that there would be then a third wave by the fall if this then exacerbates and then creates more people and passes on more infections now during the summertime?
Totally. And the reason why we will do it is not a reason that people would normally think about. Basically, if there's a lot of transmissions around the protests, then if these people go out in the community, even if there is contact tracing, what will happen is that people will be very shy about giving contacts to the people they were around. So makes it very difficult to keep the people who have disease from the people who don't. Because if you think about what you ask in contact tracing, you ask about names, addresses of people you were with. And if there were people worried about liability or people being arrested, they're probably not going to give those names easily.
And what would you tell police officers out there who are arresting these protesters if they become violent and then have to detain large groups together? That could also become a problem with COVID-19.
I would tell or advise law enforcement officers to be as humane as possible, thinking that we would love to not exacerbate hospital resources or decrease the hospital resources, because it affects all of us, not just people who are protesting. So the way that law enforcement officers can think about transmission or decreasing transmission risk include wearing masks. The more all of us wear masks, the better it is for the community, even in a protest situation. In questioning people outdoors rather than in enclosed spaces, because that's better for decreasing virus potential transmission. And also, thinking about, as you pointed out, trying not to use pepper spray or other ways of inflaming vulnerable areas that could become susceptible to COVID-19.
And we just played some video, as you were mentioning, pepper spray. People were getting milk poured onto their faces. They're touching their faces. They're getting close together with the people. And that's all the things that we're being told not to do at this time, right?
Yeah, exactly. So there's not only the risk of, droplets, but also fomites. So like you're touching surfaces, and then if your eyes and nose and mouth is being irritated by pepper spray, you're going to be touching it, rubbing your eyes and your nose and your mouth. And if you think about it, you don't have a lot of hand washing facilities or hand sanitizer out in the streets. So you'd be potentially touching a lot of surfaces and potential virus that you can then transmit to yourself.
And this form of coronavirus specifically targets the lungs. So on top of all of that, this is just going to make it all the worse for people who might be experiencing symptoms, correct?
Correct. I mean, the nose and the mouth, our normal situation is that, we're built to kind of ward off the outside world, the evils of the outside world from our bodies. And what you do with pepper spray and other irritants is that you disrupt that barrier. So it just makes it easier for things to land there when they're not supposed to be.
And then in terms of the lungs, can you speak to that?
Well, I think that's a little bit more theoretical at this moment, but we do believe that by, people having spasm of the lungs or like an asthma attack to some people, there is an acute effect and also there's a long-term effect. The acute effect is like the acute effect of you irritating the lungs. You'd be coughing. We talked about some of that risk if you had COVID, for example, in terms of transmitted. But the act of spasming your lungs itself can potentially, bring all the immune cells that could be susceptible for risk of infection around to the area because they're being irritated. And then there's a long-term effects. There's actually a literature on people who've had repeated tear gas or pepper spray exposures. And over time, they develop chronic bronchitis itself. So they can lead to other health problems, even independent of the COVID risk that we're talking about today.
Thank you so much to Dr. Peter Chin Hong, an infectious disease specialist at U.C.S.F. Health, in talking with us about these concerns.
Thanks so much for having me.
You're watching Chron On, the Bay Area streaming news 24/7.